Hi everyone, my name is Lucia Bacuzzi. This is going to be my second video, just an anatomy review. So today we're going to be talking about the abdominal wall. Just a disclaimer, I'm still a medical student. I'm in my fourth year and match is coming up in about 2 weeks. Other disclaimers, I have a dog that's chewing on some pepperoni and a upstairs neighbor that's jumping, I think. So here we go. So before we get started, I wanted to talk a little bit about some regional anatomy um, of the abdomen. So there are two systems that can define kind of the abdomen. They're called topographical divisions of the abdomen. So one of them is the four-quadrant system that you see on my left side, and then the nine-quadrant system on the right. So we're going to go over these a little more in depth in a second. So starting off super simple, this is the four-quadrant system. So we have the right, it's made up of two planes. So we have the median plane and the transumbilical plane, which splits the abdomen in four quadrants. So we have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. And this is kind of on the surface of the skin, and then you can see more in depth here the actual organs that are in each quadrant. Why is this important? Usually, depending on where you are in your medical training, you'll see this during physical exams. You'll actually be performing these during physical exams, and a lot of people come in with abdominal pain, so trying to, number one, localize the pain, and number two, try to narrow down on differential of what actually is going on in that area based on what organs are located there. So just as a review, these are the four quadrants. So the right upper quadrant, you have most of the liver, which would be right here. You have the ascending and the transverse colon. You have the gallbladder, which is that little green organ right there. You have the duodenum, so you see the stomach over here and then the duodenum. You can't really see this well, but you do have the head and neck of the pancreas. And then you have the pylorus over here, stomach, pylorus, and then you have some of the small bowel over here. For the left upper quadrant, again, you have most of the stomach, like the fundus and all of that of the stomach. You have the spleen, which would be over here. You have the transverse and descending colon. You have the body and tail of the pancreas, which you really can't see, the small bowel again, and then the left lobe of the liver. And then just remember when you're looking at something, like how you will be doing on radiographs and stuff, this is the right, this is the left side. Then you have the right lower quadrant over here, and you'll have some of the ascending colon. You'll have the appendix, and the cecum, and then you're going to have the small bowel. And then lastly, the left lower quadrant, you'll have the descending, so again, ascending, transverse, and now we have the descending colon, the sigmoid colon, and some of the small bowel. So now we're going to get a little more detailed into the 9-region system. That's defined by the mid-clavicular, so here are your clavicles, mid-clavicular planes, so you're going to have two on both sides. Then we have the subcostal plane. Most people use the transpyloric plane, however, so I'm going to stick to that. And then the intertubercular plane, which is going to be over here. And based on that, you're able to kind of get this 9-quadrant system where you have the right hypochondriac region, the epigastric region, which is going to be very high yield when you're on clinical floors, the left hypochondriac region, right lumbar, umbilical region, the left lumbar region, the right iliac region, hypogastric, and then the left iliac region. Okay, so we were talking about the transpyloric plane. So again, that's kind of what we're using for the nine system delineation. Really important. This is to know kind of what structures go through, or the what structures the transpyloric plane uh, hypothetically like passes through. So the first structure, and this is kind of not the best image, but we're just going to work with it. But we can see L5, L4, L3, L2, and L1. So this is the transpyloric plane. So the L1 vertebrae, the plane passes through it. Then we have the pylorus of the stomach, um, which is kind of not really well seen, but it does pass through. Then you have the first part of the duodenum over here. You have the fundus of the gallbladder, which you can't see the gallbladder at all here. Then you have the neck and body. So, like, the neck would be over here, body of the pancreas. This is more of like the tail. You have the hyla of the kidneys, and then the origin of the SMA, which, again, you cannot see here. Okay, because I felt really bad about the last image, I added a more detailed image, and this is from my wonderful professor of anatomy. He was very detailed. So this is going to be the transpyloric plane, so you can see it right here. And then we said it goes through L1, which you can't really see here, but we do see the pylorus of the stomach. We see the first part of the duodenum. The gallbladder is not shown, and then here there's actually a delineation between the neck and body of the pancreas, the hyla of the kidneys, and the origin of the SMA. So you have the SMA right here. Okay, so now we're going to get a little bit more into surface landmarks. So we just talked about the transumbilical plane, transpyloric plane, and now I wanted to kind of turn our attention to McBurney's point, which is going to be right here. So this point is defined as 1/3 the distance between the umbilicus and the ASIS, or the anterior superior iliac spine. And why is it important? It's the site, most common site, where the base of the appendix attaches to the cecum. And so a lot of times in people with appendicitis, this is the point that really hurts them. It'll kind of start off here, and then you'll see in textbooks that it kind of migrates to the paraumbilical region. The pain does, at least. All right, so now we're going to talk a little bit more about the layers of the abdomen, and there's many, many, many layers. So we're going to take it step by step. So first layer, coming from kind of the outside, obviously you have the skin, and then from there you have what's called the Camper's fascia, which is the superficial fascia or the fatty layer. So this is right under, and it's this kind of like yellow goop right here, and that's what contains fat, and it varies in thickness between people to people. I remember during our anatomy lectures, our professor would say that Camper's fascia is like when you're camping at night and you're really cold, you want like a lot of layers of essentially fat to keep you warm. So that was a way to remember it. So then you have what's called Scarpa's fascia, which is actually not really pictured here pretty well, but it's right here. And that's kind of the deeper membranous layer, and it actually contains little to no fat. So we talked a little bit about the layers. Now we're going to talk about the muscles of the abdominal wall. So I'm going to see, okay, so I can't go back, but I'm going to have many pictures of all these muscles. We're not really going to, this chart is just basically to organize thoughts. So the muscles that we'll be talking about are the external oblique muscle, the internal oblique muscle, the transverse abdominis, rectus abdominis, and sometimes the pyramidalis. And I'm sorry if I'm saying any of these wrong. So first muscle we're going to talk about is the most external, and it's called the external oblique muscle. It's pictured over here. For each of these muscles, we're just going to briefly go over origin, insertion, innervation, arterial supply, and the actual function. So external oblique muscles, our professor would always say the fibers are actually going inferior medially. And so it's kind of like putting your hands in your hoodie pocket. The origin is external surfaces and the inferior border of ribs 5 through 12. Insertion, you could kind of see here ASIS, the anterior half of the iliac crest, the pubic crest, the pubic tubercle, and then the linea alba. Innervation, and I know that these sound really complicated right now, but you'll see that many of these muscles are innervated by the same thing. So you have the thoracoabdominal nerves, which is T7 to T11, and the subcostal nerves, which are T12. Arterial supply is also pretty overwhelming, but we'll see it over and over again. So the lower posterior intercostal, subcostal, deep, circumflex iliac, and superior and inferior epigastric arteries. And then the function is going to be similar for this one to all the rest, which is flexing, rotating the trunk, and compressing and supporting the abdominal structures. This is just a fun fact, and important, of course. So the external oblique muscle, actually its aponeurosis, is what forms the inguinal ligament. So that's what we're seeing here. We have the external obliques and then the inguinal ligament here, and it also forms the crura of the superficial inguinal ring, which you could see right here. Next, we have the internal oblique muscles. So external oblique, it was like putting your hands in your hoodie. This is the opposite way. So the origin of this is the thoracolumbar fascia, the iliac crest, and the inguinal ligament. So I just put a picture here just to show the thoracolumbar fascia, and then here's the internal oblique coming off. Insertion is going to be the costal margins, inferior borders of the ribs, specifically 10 to 12, linea alba, and then the pecten pubis by the conjoint tendon. And again, the innervations, this one's a little different, has a little more innervation, but again, we have the thoracoabdominal nerves T7 to T11, the subcostal nerves T12, and L1, which include the iliohypogastric nerve and the ilioinguinal nerve. Arterial supply is going to be the same, so we have the lower posterior intercostal, subcostal, deep circumflex iliac, and the superior epigastric arteries as well as the inferior epigastric arteries. And then function is the same, so compresses and supports the abdominal content, and it flexes and rotates the trunk. Next, we have the transversus abdominis muscle. This is the innermost muscle. These fibers are kind of going straight across. Origin is going to be ribs, costal margins, ribs 7 to 12. Again, this is from the thoracolumbar fascia, iliac crest, and the inguinal ligament. Insertion is going to be on the linea alba, pubic crest, and pecten pubis by the conjoint tendon. And then we have innervations again from T7 basically to T12 and L1. And I'm not going to repeat the arterial supply or the functions because they're the same as prior. All right, and then I just wanted to insert this. I remember when I was studying for this, I was like, what is a pecten pubis and what is a conjoint tendon? And there wasn't many images that were really good at showing both, so we're going to kind of piece this together. But this is the pecten pubis, and I spelled it wrong, and then right here, and then the conjoint tendon is right here. So for a lot of those insertions, this is what they're talking about. Next, we're going to talk about the rectus abdominis muscle, or what a lot of people say are abs. This is kind of your classic representation of abdominal muscles. So the origin is from the pubic crest and the pubic symphysis, and then insertion is going to be to the xiphoid process of the sternum and the costal cartilage of ribs 5 through 7. Innervation, again, is going to be T7 to T12, and then arterial supply for this is going to be the superior and inferior epigastric arteries. And then lastly, same function, so it's going to flex the trunk, compress the abdomen, and actually additionally will stabilize and control the tilt of the pelvis. And then it's intersected by these tendinous intersections, so you can kind of see them right here. So that's these kind of like multiple fibrous bands that dissect the rectus abdominis muscle. And then I find this muscle super interesting, the pyramidalis muscle. This is what it looks like. It's right here. It's a triangular shaped muscle. It's actually absent in about 20% of the population. Its origin is from the pubis and the anterior pubic ligament. Its insertion is going to be on the linea alba, which is this, and then innervation is going to be T12 and L1. The function is to actually tighten up and tense the linea alba. Its supply is only going to be from the inferior epigastric artery, and then just a fun fact, it lies in front of the rectus abdominis muscle. So you can see rectus abdominis, and then it's kind of right in front of it. Then we have the rectus sheath. That's kind of this like, if you could imagine just like plaster of kind of like gift wrap or something of plastic above the rectus abdominis muscle. This is what it looks like. So when you peel that off, you're going to see the actual rectus abdominis muscles. And what the rectus sheath is an aponeurosis of the external oblique, internal oblique, and transverse abdominal muscles. They fuse, so the rectus sheath fuses at the linea semilunaris. So that's what this is here and kind of over here. And then it crosses at the linea alba. Next, we're going to talk about the arcuate line. So the arcuate line is a really interesting concept. It's this crescent-shaped line that marks the inferior-most boundary of the posterior rectus sheath, and we'll go over what that actually means in a second. But its location is 1/3 the distance between the umbilicus and the pubic crest. So yeah, we'll get into it on the next slide. Okay, I lied, maybe in a few slides. But next we're going to talk about the transversalis fascia, and that's that layer that's deeper, deep to the rectus sheath and muscle, and as well as the rectus abdominis muscle. So that's what this kind of green layer is right here. Okay, so talking about above and below the arcuate line. So we're looking right here for now. This entire slide is going to be only about the above the arcuate line. So above the arcuate line, you have the anterior rectus sheath, which is right here, and then you have the posterior rectus sheath. So what comprises the anterior rectus sheath above the arcuate line is going to be the external oblique and the internal oblique, or half of the internal oblique aponeuroses. For the posterior rectus sheath, still above the arcuate line, is going to be that other half of the internal oblique aponeuroses, as well as the transverse abdominis aponeuroses. So again, we're only looking at this for this slide. Now we're only talking about here on the bottom, so that's below the arcuate line. It still has an anterior rectus sheath, and the rectus sheath actually is going to comprise of everything. So the external oblique, internal oblique, and the transverse abdominis aponeuroses. However, the posterior rectus sheath, there is none. So as you can see here, this kind of blue line right here. So even though there is no posterior rectus sheath present, there's only the transverse salus fascia and the parietal peritoneum that are present. All right, so I just wanted to have a slide kind of going over just a summary of the abdominal wall innervation. So we talked a lot about these 4 nerves. So again, we talked about the external oblique, internal oblique, transversalis muscles, the rectus abdominis. So they were either innervated by one of these, all of these, or all of these except for some of these. So the thoracoabdominal nerves we said was T7 to T11. So you can see them right here. So T7, T11, and then also right here, so T7, T8, T9 until T11. And so they innervate most of the anterior lateral abdominal wall, and they course actually between the internal oblique and transverse abdominis muscles. Then you have the subcostal nerve, which is T12, which is located right here. This is only the cutaneous branch, but it's located right there. And then when we talk about L1, we're talking about both the iliohypogastric nerve as well as the ilioinguinal nerve. So that's kind of what's going on right here and right here. Also, this is not the last that you will see of these nerves, so just keep that in mind. So we're going to contrast a little bit about innervation and dermatomes of the abdomen. So this was when I was starting off with anatomy, I really didn't understand what this was at all. So dermatomes, just for anyone listening that might also have the same question, that's an area of skin that's mainly supplied by sensory nerve fibers that are from a single spinal nerve. That's really important. So sensory nerve fibers, and they're only from a single spinal nerve. So as you can see here, a lot of the ones that we talk about, this is a super important dermatome, is T10, and people really say that 10, you can think about it as the 0 reminding you of an umbilicus, because that is going to be your sensory nerve fibers from spinal nerve T10 at the level of the umbilicus. And then you have T12 that you can see kind of around here. And that will innervate the lower abdomen right above the pubic symphysis. Now we're going to get into important arteries of abdominal wall. So this is really interesting and can be complicated if it's like the first time you're seeing this, so we're going to try to break this down as much as possible. I feel like this image is pretty good. So you have the internal thoracic arteries, which you can't really see here, but I have a better image. And then it gives off these terminal branches, 2 terminal branches. So one of them is going to be the superior epigastric artery, and the other one is going to be the musculophrenic artery. So that's like super important. Anatomy 101, that will be a question. What are the 2 terminal branches of the internal thoracic artery? So knowing those would be really important. And then there's also an inferior epigastric artery, and we talked a lot about these other arteries when we were talking about the arterial supply of the external, internal, and transabdominis muscles. So you can kind of see that here, internal thoracic, and then it branches off, and then the inferior epigastric arteries over here, coming off of the external iliac artery. So this is kind of a summary of what I just said, but doesn't hurt to repeat it one more time. So the really important arteries of the abdominal wall, you're going to have your superior epigastric artery, and you can kind of see it here a little better. So that's coming off the internal thoracic artery, and it's going to go down over here and kind of supply just like in the middle, the anterior abdominal wall, and then the musculophrenic artery is going to kind of supply the anterior lateral abdominal wall, and then the inferior epigastric artery is a branch of the external iliac artery, and you can see it kind of supplying the other half that the superior epigastric artery is not. And then here are the veins. I feel like veins in anatomy sometimes don't get that much highlight, and unfortunately I feel like I'm not going to do this any more justice, but here we have the lateral thoracic vein, the thoracodorsal vein, that's a really important one, and then the paraumbilical veins, which are really important, and the thoracoepigastric vein. All right, and then lastly, the lymphatics of the abdominal wall. So to keep it pretty simple, we're gonna keep this like kind of going back full circle. So we talked before about what actually makes up the 4-quadrant system, and we said it was the one of the planes was the transumbilical plane, and that's basically what we're going to use to determine whether or not the lymphatics are going up here or down here. So if the lymphatics are located above the transumbilical plane, they drain mostly to the axillary lymph nodes. That being said, that's mostly. They can also drain to the parasternal lymph nodes, which are here. Para means kind of side by side, and then the sternum. So that makes sense. And then the inferior lymphatics, that's if they are located below the transumbilical plane, then they would drain into the superficial inguinal lymph nodes right here. And then just kind of to end this with some ligaments, so keeping the arcuate line kind of theme here. So above the arcuate line, we have the falciform ligament, and that's my dog sighing, and the round ligament of the liver. So that would be above the arcuate line, and then below the arcuate line, we have a bunch of ligaments that can get really confusing, so we'll go over them in a second. But that's the median umbilical ligament, the medial umbilical ligament, and the lateral umbilical ligament. It's really important to kind of, when you're in anatomy lab, you're going to look at these, and it's going to be really hard to kind of figure out because they all sound very similar. So we can start with kind of the middle. So I think of median, like the sum, like I know that's mean, but like mean, median, mode, like it's like the middle of everything. The medial is like not lateral, basically. It's kind of in the middle, and then the lateral is the most lateral. And then really important to know about the remnants. So the median umbilical ligament has like a really big role. It was the obliterated urachus. The medial, I think of medial umbilical artery. So that's the obliterated umbilical artery, and then the lateral umbilical ligament is the inferior epigastric vessels. Just because I'm a picture person, I wanted to include an image of the urachus. So again, this is the remnant would be the median umbilical ligament, and so this is the urachus right here, and it's kind of this fibrous cord that used to connect the bladder to the umbilicus in babies. Going a little out of order here, so I apologize for that, but we talked about 2 ligaments that were located above the arcuate line, and one of them was the falciform ligament. And so I just wanted to show that a little better here. So that's the falciform ligament, and if you actually see the image of the liver, it's right here. And so that ligament basically connects the liver to the anterior abdominal wall. And then this was the other ligament that was located above the arcuate line, and this is our last slide. So round ligament, I'm going to butcher this, but it's also called or known as the ligamentum teres hepatis, and you can see it right here, and also right here. And that is the remnant of the umbilical vein. And what the umbilical vein used to do was extend from the umbilicus of the baby to the liver. And also super important, it contains the para-umbilical veins.